Benefits podcast with our host, Tom Quigley of ClaimLinx. Tom, how are you? And our topic today, healthcare worker shortage, how it's driving up costs for employers. Why are we having a healthcare worker shortage?
A vehicle causing noise.
And we don't hear it. We don't hear it. So keep going.
I'm sorry, repeat the question.
Yeah, the question basically is that healthcare worker shortage, how's it driving up costs for employers? Why is that happening, Tom?
Health workers,
Healthcare worker shortage.
they're coming out in this country, these people to get a degree are coming out broke. They have all this debt. So a lot of people aren't going into the medical schools and extra years that they would have to create more college loans. So you're getting a lot of people who are not getting into the field anymore. And you also have a lot of people in the field who are burnt out. The COVID really did a hit on a lot of them.
The interesting, and that's in the reason also, do you think people are not going to school for healthcare because of the problems in healthcare?
Most countries pay for the people to become doctors. You got to give them so many years. And if they did that, they would be so much better off. This country. Some states do that. If you give the state X amount after you get your degree and you're a doctor, they forgive your college loans.
And also the other thing is why there are fewer providers too for health.
Because the insurance carriers, not the carriers, but the hospitals have been buying up all these practices. There's fewer and fewer choices because the hospitals now own the physician groups also.
And that leaves a lot of the relationship with the doctor and the patient, doesn't it? It hurts the whole.
And I don't blame the docs. Millions of dollars for their practice, and now they work for the hospital. But the hospital is all about profit. They limit the number of minutes per visit, those type of things.
And that's a shame to know that you're not getting that care needed. That's why I guess a lot of people look at the alternative medicine opportunities to go to.
I want doctor. You just pay him a monthly fee versus doing the traditional pay as you go, pay a fee doctors. Those are the best way.
And then you don't have, then you're just paying out of pocket versus using your healthcare for to just lease that park. And then use the insurance is so important for every American because of the potential of a catastrophic thing happening. That's for sure.
Exactly. So that's what's happening is everyone is going out. And the shortage of docs, nurses, and everything is driving up costs. Everything, health insurance, and then medical technology is driving. MRI, those cost money. A lot of people are not aware of that.
And then also with delayed care, this is also driving up costs too, right? For bigger claims because of healthcare issues.
You need a hernia surgery and you wait an extra year and perpetrates or whatever.
Okay.
Fortunately, you get burned.
What smart employers can do now to try to offset this impact? What types of things should they do?
Employers set up programs, medical expense plan, where they will reimburse the doctors that charge fees. If you want to go to one, we'll gladly pick up your $60 fee a month. Tax-free.
And then also the great evolution of telehealth helps too, doesn't it?
Telehealth is just a method. Like yesterday, I called when my wife got stung by 9 or 10 bees. I called the telehealth and they told me to bring her to a urgent care emergency room right away because You want to make sure she's not having a reaction, and they make sure she isn't, and they gave her medicine to combat it.
And and then also this preventative programs. Talk about that.
You got preventative wellness programs that are available that you can go out and get your physical year. Like, I have a special vitamin made for me. They took my blood and urine and created a vitamin of what I need, the nutrients I'm missing, and they create your own vitamin. These are things that can be covered tax-free by an employer.
Wow. So you don't always have to look at exactly what's in the plan. The employer can figure out other ways to make their employees more healthy.
And happy.
Yeah.
The current systems, unfortunately, it's corrupt. So you have to understand, when you're running with thieves, you don't have to be a thief, but you got to understand what they're doing, or you're going to get blown away.
Okay. The best place to go is claimlinx.com to contact you today, for people to contact you. Either individuals can contact you or companies.
Exactly.
All right. Appreciate it. Thanks again, Tom. All right. That's a special simulcast of the Neil Haley Show. The Edge Benefits Podcast, guys. Take care.